So today we're going to talk about the tell me about yourself question. A lot of people hate this question. I know it makes me want to start talking about cats. So I want to give you a tip that I think will be helpful for you. Instead of tell me about yourself, imagine they asked you, so of all the things you could have done, what got you into nursing? Or tell me how you became interested in nursing and your journey so far. So think just for a moment, pause this video and think about the honest reason of why you're interested in being a nurse. So some really common reasons could be that you really just want to help people, right? Or maybe you were a patient, or maybe you had a family member who was sick and you got to know a nurse in the process and you really liked the work that nurses do, and that inspired you to want to pursue nursing. Or maybe you have a family member who is a nurse and you've always looked up to them. What are the qualities that you look up to in them? Maybe you've always been really curious about how the human body works and you want a career that will let you take classes that will teach you more about that, because that's your interest and you also really want to help people. Or maybe you chose another career and you've been really unsatisfied because you really have this push to help people, and you want a career that will allow you to do that in a way that you think would be more fulfilling. Whatever the honest reason is, take a minute and write down some brainstorming ideas of what the honest answer is for you. And then once you talk about what got you interested in nursing, you'll want to start talking about the different relevant experiences that you've had, right? I tried this volunteer experience and that taught me this, and I'm really grateful for such and such experience that I got with that. Or, when I went into nursing school, the rotation that was most exciting for me was, whatever kind of unit you're applying for. Talk about what in nursing you've experienced so far and what it's meant to you and where you're hoping to go, what kind of patients you're hoping to work with, what qualities you really want to develop as a nurse. And then you can finish it off by saying maybe why you're really interested in working at the hospital that you're applying for. The best tip that I can give you with this question is that this is a really good opportunity for you to instantly build rapport with your interviewers. They don't want to see you kind of give like a really rehearsed answer that feels like you're not willing to connect with them and be authentic. So be authentic, laugh, smile, tell them something cool about yourself, right? Like if you're from another country, or if you really like to cook, or whatever it is that kind of stands out about you, it'll go a long way if you can start laughing and smiling with them right in the beginning. It'll build trust. They'll feel like you're not just giving them a super rehearsed, pageanty kind of answer with all the right buzzwords. And if you're nervous, the best tip I've ever heard for nervousness, especially with this question, and if anybody knows, I don't remember where I read this, if anybody knows where this is from, please let me know so I can give credit. But the tip is to project openness and warmth. I don't know about you, but when I think about projecting openness and warmth, it's kind of impossible for me to be nervous at the same time. So that's another tip that may help you with this question.